on the holidays when other healthcare providers may be taking vacation or otherwise be unavailable. But when it comes to emergency department waits, these low acuity visits are really not the major drivers of the problem.
Always have a challenge around staffing, around access, around patient loads.
We start our shift with a full waiting room. We leave our shift with a full waiting room.
So either see you in the hallway and reduce your wait time from, to 3 or 4 hours, or wait for your turn to have a private stretcher and wait to be seen 6 to 8 hours.
We don't want private healthcare like they have in the United States of America, right? There's 30,000 patients a year that die because they don't have access to insurance.
We have to balance our absolute drive to help people with the absolute need for our safety.
The Canadian Association of Emergency Physicians put out a statement on virtual care. If there is not an emergency physician in the emergency department, you cannot safely label it an emergency department.
The harassment and muzzling and silencing and bullying of frontline providers needs to stop.
There's nothing wrong with informing the patient population in the emergency department that they're overcrowded and under-resourced. And in fact, as frontline physicians, we have a duty to inform our patients about the environment that they're getting care in.
Is the physician at triage also available to deliver critical care, or are they only going to be in a triage situation, i.e. a virtual situation? And again, you get back to that problem that if the patient needs immediate life-saving care, who is going to deliver that?
The challenge is that you have to think long-term in healthcare. The human health resources planning that we need that we don't have, the accountability frameworks that we need that we don't have, these are not 4-year cycles.
We're starting to see over the last several decades an incremental worsening of how emergency care can be delivered in Canada.
Part of this rhetoric misses the nuance. These workers fill real gaps in a very overstretched system, and there isn't really a pool of trained Canadians ready to fill these gaps at a moment's notice. And so the real issue isn't overdependence on these foreign workers, it's more so under-planning.
When people receive abnormal results from such a test, it often creates a sense of panic, and that will bring people to see their family physician, bring them to the emergency department, and will increase the burden and potentially the wait times.
I shouldn't be having to give such bad news to patients on a shift when, having access to primary care would be so helpful.
It looks like that's a systems problem, right? We don't think that's a people problem. We don't think we suddenly have a group of healthcare providers who are unempathetic and uncompassionate and don't care and just are in this for the money. What it means is that you're getting physicians who may be outstanding in a variety of areas, commendation, super compassionate, but now they're getting complaints, and you have to ask why. And
so when someone's been triaged, but they haven't been seen potentially by the physician yet, that is a bit of a gray zone or a black box. We don't know what's there, and some patients might be getting sicker during that time. So the earlier we can see patients, the better that it is.
Quite a number of patients are presenting with flu or flu-like illness in higher numbers than we would typically expect for this time of year.